Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient and been dealing with cancer now for real close to 2 years, and I'm doing much better. And I'm so happy to be here to have an interview with a real special individual. And we'll get into it. And his name is Dr. Gary Phillips. And I this is the first time that I've actually met someone in person who has a great story that I want to share with everyone. And so at this time, I'd like to quickly introduce Dr. Gary Phillips. Gary, would you please introduce yourself? Tell us real briefly, a little bit about yourself, and then we're going to get into the main meat of this conversation.
Absolutely. Thank you, Mark, for having me on your incredible platform. I'm Dr. Gary Phillips. I'm a retired chiropractic physician and nurse, and I am medically retired, which we'll talk about. But my professional life as a chiropractic doc and nurse, which started in high school, was inspired by my mom. And my mom, that we'll talk about, was in healthcare, and that inspired my journey into healthcare about helping people. And her eventual diagnosis of cancer changed my life. So I've had the blessing of practicing in healthcare for over 38 years, now over 40 years. That started in high school. I was able to, given the opportunity in my 11th grade year to, if I wanted to be involved with healthcare, there was a Los Angeles Unified School District vocational nursing program, LVN program, that was offered at my high school. It was the last year it was being offered. And in 11th grade, they sent a notice around, said anyone interested in healthcare, we're offering a vocational nursing program absolutely free. And all you'd have to do is take a government class in the summer of your 11th grade year, and you'll begin your 12th grade senior year in the program. You'll graduate high school with an LVN license to practice nursing. And I thought, this is a great beginning to my journey in healthcare, inspired by my mom. And I did that. I graduated high school with honors and a nursing degree in LVN, and then throughout my entire bachelor's and master's degrees in exercise physiology and sports medicine, my journey was going towards orthopedic medicine or orthopedic surgery, or just sports medicine, that kind of medicine I wanted to practice. I ended up meeting my wife, who was helped by a chiropractic doctor after she was in a horrible injury at age 14. They were on the freeway. They got hit by a drunk driver. Mom and dad were driving. Jackie and her sister in the back seat were, impacted. Her sister fainted. She had spinal shock from that. Her legs were crossed. I guess she was sitting in a lotus position in the back seat. They got hit. She was paralyzed from the waist down. Parents were shaken up. Took her to the hospital, and the doctor said, we just need to do surgery. And her mom was like, why do you need to do surgery? Isn't there a conservative approach? Isn't there some reason why you could find out without cutting her open as to why she can't move her legs? And so this blessed pediatrician, Dr. Saxon, at that time said to her mom, you know what? There's a possibility that she could have just sustained spinal shock. And as a medical doctor, their approach is very conventional and diagnostic related. And this actual medical doctor had a positive chiropractic experience and shared that with Jackie's mom and said, look, I understand your reservations about surgery. So I have been helped and my family by a chiropractic doc. And I'm going to recommend that maybe as a conservative beginning to finding out why Jackie couldn't walk, why don't you take her to a chiropractor? So her mom said, absolutely, natural approach, no drugs, no surgery. I'm all for it. And they're a South American Ecuadorian family, so very conservative upbringing, natural, from the Amazon. So turned out her mom took her to a chiropractor in Burbank, and we were dating in 1987, and I actually
Okay.
went with her.
Can I pause you there for a little bit,
Yeah,
Gary? We're getting into the meat, and I want to talk about something,
no problem.
how all of this came together, and I want to share something with everyone. Last Saturday, my daughter got married up in Santa Maria. There was a big wedding, and this is when I had the great honor and opportunity to meet you. And the way that happened was, uh, your daughter, Nicole, has been friends with my daughter, Tani, for many years, since they were in high school, I believe.
10 years.
And and actually Nicole was a part of the wedding party. And what was fascinating to me was, at this wedding, there were a number of people there that my daughter had grown up with, starting from preschool. So she was like 4 or 5, and there was a number of people that we had known that long. So to see the maturity and the growth of these people was just such a beautiful thing, and truly an honor. And so the day before the wedding, Nicole had come up to me, and she she said some things that just blew my mind, because she said, uh, I'm so happy to talk. She said, I'm so happy to talk to you. And we've been praying for you, and we've been concerned about your health. And I had no idea. And I talked to my daughter, Tani, afterwards, and she said, yeah, she's been asking how you're doing. And so we talked, and it was such a wonderful conversation. And I love uh, hearing great stories. And so she started uh, talking to me about her dad, which is you, Gary. And she was saying that, that you have had a number of health issues to deal with. And she started explaining it. And I'm not going to take away your thunder at all, because that's why we're here. But at the wedding, it was just such an incredible event. It came off really well. And I wanted to get your feelings about it as well. What were your thoughts about the wedding? And and that's when we had a great opportunity to sit down, and I'm so honored to get to know you, and further even with this interview. So, Dr. Gary, please share your input.
So, Mark, we were touched. Nicole shared that conversation with me, and we were touched a couple of years ago. And I think when you were diagnosed, um, praying for you as a family and your journey. And she told me that she had a conversation with you before the wedding, and that you shared, your journey, and she was sharing a little bit about my journey, and I just couldn't believe that you were actually vertical and able to, be healthy enough to attend the wedding. And I know that there was thoughts about, you not being able to attend, but Nikki and Tani have been friends since high school. And so we've always, they've had a great close relationship. Nikki has shared with me about, how you were doing. And then I was just amazed when I had a chance to meet you and share with you a little, find out about your journey and what you were doing, and about, I shared a little bit about my, rare blood disease that I've been battling. and now thriving with. So it was amazing. The wedding was beautiful. It was so nice to meet the family and be there with Tani and her new husband. Or I know that they were married before civilly, but this was the formality. And it was just so nice to see you, so different than what I saw in pictures a year prior when you were, really sick. So we were just resonating back and forth when we were talking. We sat down for about an hour at the wedding talking about our individual journeys, and just definitely God breathed and divinely intervened, us meeting as well as our success in overcoming, life-threatening illness.
Yeah, it's so beautiful, and that's what really resonated with me at the wedding, was just the opportunity and the honor to get to know people that I had never really talked to, and so that was great. But I had the opportunity to sit right next to um, Lynette Lynette Larson, who and also her daughter Maggie, who watched the channel, and to hear some of her comments, and so that was really exciting for me as well. So hello, Lynette, you're in the video. And she comments to me all the time, and she makes comments about the video. So thank you for your support and your love, and we consider her to be family as well. And she mentioned something to me that I had to do a double take and really think back. And she said, you know, you've known me since I was in high school. And I thought back and I said, wow, it's been that long. So I had so many journeys with people at the wedding that I've known for decades and decades. And this was just another one. So thank you, Lynette, for sitting next to me, or I sat next to you, however it happened. And thank you for joining us and making the trip up. We were up near Santa Maria. And thank you to Tani's in-laws for hosting it, Dean and Patty Tuck. And it just came out really great. And I think everybody was really happy with the way everything happened, and things came together. And my daughter and Patty were very detail oriented, and they really uh, analyzed each aspect of the whole day, and they did absolutely phenomenal. So thank you for everyone. There is also an army who helped contribute to putting it up and taking it down. And so I thank everyone from the bottom of my heart for making the event such a wonderful, wonderful event.
It was a
So
beautiful venue in the middle of the vineyards and the ranch, and it was just a beautiful outdoor setting at sunset, and it was dreamy, and I think it was just the way you and the family would have wanted it.
yeah, I mean, we got lucky on all fronts. The weather cooperated, and
Beautiful.
everything went smoothly. Uh, it took tremendous effort from a lot of people. And another person I'd like to mention is my daughter Lisa, and she worked really hard and did an amazing job, as well as Karen, who put up all the flowers, and the cooks who cooked the food, and the food was fabulous. So yeah, it was really great. So let's do this. Let's excuse me. Let's kick off this interview, and let's start at the beginning of your journey, and let's go back to talking about your mom and her journey. And please share with us what happened there.
So, my mom uh, was a medical record librarian with Cedars of Lebanon, which is now Cedars Sinai Medical Center. And it's funny that she was in a medical records library, and so in the medical library, and she, in her adult life, when I knew her, was managing doctors' practices. She was a medical office manager. So she shared, and we knew that when she was 14, she was irradiated on her face by a very silly dermatologist. Radiation was used to treat her acne. And as a result of that radiation for her acne at age 14 by a dermatologist, I believe 18 years later, she developed thyroid cancer. And when they tried to remove the thyroid, they apparently at the time removed the thyroid, but the margins around the cancer were unclear, meaning that when they did the biopsies, there were still cancer cells left. This was a problem. So they had her drink iodine and whatever their treatments were at the time, that was one of them. But the margins were unclear. And then in my adult life, we discovered, I believe I was in my 20s, that she had had a metastatic spread of that thyroid cancer to her breast. And adenocarcinoma of her breast, a lump was found. She had the lump removed, radiation. This was during my adult life in the 20s. And so, late 20s, I believe. So when we got this diagnosis, the beginning, this was very typical, but very ugly. The doctor that sat us down and the whole family basically said, Rose, now my mom, I should say, as a disclaimer, my mom, very strong, farm-raised woman in Canada, very intelligent, very willful, didn't take anybody's opinion. She did it her way. She was very well-researched. So when the doctor, the oncologist, sat the family down and said, Rose, you've got 4 months to live, pack your bags. The most arrogant, cold individual I've ever met. We all dropped our jaws. We knew what my mom was going to say, but my mom said, hey, doc, thank you so much for sharing, but I got some living to do and I'll be signing out now. Goodbye. And I was just, we were like clapping. But this doctor, and this is conventional medicine, very common, played God and said, you're going to, and now the majority of the people that hear that kind of diagnosis, as you're well aware, and I'm sure friends and family in your life, my life, and in my career as in healthcare, whatever the doctor says, the majority of the people will literally die within 4 months to the day. Unless they have a little bit of gonus and willpower, and unless they basically don't accept any kind of news like that from anybody except God, and then they move on with their life and take different approaches, and depending on what's going on. So my mom said, thanks, bye. Well, they did recommend
I
chemotherapy.
love that, by the way. I'm clapping right here, right now. That's awesome.
They did me being, in healthcare, I have 3 sisters that were all in different careers, not related to healthcare. So I was the youngest of 4. I was the baby, and pretty much closest to my mom with regard to her healthcare journey. So they gave her a diagnosis. They said, we have chemotherapy, but it wouldn't do anything to cure. It would just basically may extend, not knowing the effects of chemotherapy. But what happened is I took her to chemotherapy at UCLA every Tuesday, and we spent the day having fun. 1%, 5% of the day was chemotherapy doctor's appointment at UCLA. The rest of the day, we went to lunches, we walked on the beach. I closed with my mom. She lived 2 years because of her incredible spirit, and never giving up. Now, she wasn't like into alternative medicine. She wasn't into naturopathy. She was very conventional, but she was just taking it in stride and doing the best she could. So 2 years of 2 years of chemotherapy. And I had a wonderful, wonderful time with her. And the last 2 months of her life, when she was having a lot of, now it had spread from the breast to the liver in that time period. And the liver, so she had what's called iatrogenic carcinoma. Iatrogenic means physician induced. This is not the best news that you would want to hear, that it was a stupid dermatologist that irradiated her face for acne, non-conventional treatment that caused her end with cancer. And so she fought, and at the very last 2 months at UCLA, we were going for treatment. She was having a lot of paracentesis and tapping from all the fluid, but nobody ever offered hospice when she was indeed terminally ill. Terminal diagnosis with a cancer patient is 6 months or less to live based upon their diagnosis and their cancer. And hospice, which is care for terminally ill people, is covered by Medicare and Medicaid and fully available. And at this time in 1992, in the summer, at UCLA, she spent a lot of time in the hospital, but not one doctor, nurse, social worker, anybody ever recommended that, hey, Rose, do you want to be with your family in this time of challenge? Do you want to, hospice care? Do you know about hospice care? It's, where you can be wherever you want to be and provide, have comfort care until your last breath. Nobody ever described that. And yet in nursing, my wife knew that it was available. So what that did is my mom passed without hospice care. And that began that changed my life. And that was what led me, after I retired from chiropractic healthcare, as a registered nurse, into hospice care. So we can talk about that. But I shared that story with every patient family, offering them. And so I worked with a large hospice in 2001. And so I was an admissions nurse, and every single patient family that I was brought to all over the Southland, I shared that story with my mom, about my mom, and 100% of the patients engaged in hospice care. At the time that I began working with that hospice, they had about a 50% conversion, meaning doctors would refer them to the hospice, but only half the people and families would engage and accept that care. They were having a problem at the hospice. When I was passionate, brought my passion and profession together, every single family, and there were hundreds, came onto service, and we brought that ratio to 100% within 3 months. So that changed my life and my approach to peaceful and compassionate care at the end of life.
So there's so much to talk about. In fact, I forgot to mention that we're going to bring Dr. Gary back for part 2 because there's just so much to talk about. And so I'm excited that we're going to have another segment to this.
Thank you for that.
But can you talk about your own personal health journey? I think that's very important as well.
So in 1993, I would think I was 22 years old. Let's see, 63, 62, 90. I was 31, and I was doing some karate. I was already, at the time, a nurse, and I was already 2 years into private practice. I got kicked my elbow, and I bruised purple bruise. My entire arm was purple after I got kicked. So, we thought it was just terrible. When that happens, it's typically because, there's like leukemia or a blood disease. Went to the emergency room and they diagnosed a condition called idiopathic thrombocytopenic purpura, which means no known cause, idiopathic. Thrombocytopenia is low platelet count. Your platelets are the little blood cells that plug up the holes and clot to prevent bleeding. And purpura is the bruising that results from that bleeding. So this condition is considered a rare blood disorder. It happens in children under 1, pregnant women, and adult females. And I was a 31-year-old adult male. So it was very, very uncommon. And the way it's triggered, it's an autoimmune illness. What happens is, at the time that I got kicked, I didn't know it, but I had a flu or a cold. And a cold virus, influenza A, the cold virus, ramps up the immune system. Your body tries to fight it off. And in 1 to 2 weeks, most people heal from the cold. In my case, my immune system began destroying my platelets at a very rapid rate. And this is characteristic of this diagnosis. So what happens is your platelet count drops. A normal platelet count is like 130 to 400,000. Mine on diagnosis was 8,000. If it's under 50,000, you can bleed to death. If it's under 10,000, you can spontaneously bleed by stepping off a curb or coughing. So wow. I was life threatened. They determined that I needed to be on high dose steroids. Steroids are used, IV steroids and oral steroids are used to calm the body's immune response to stop destroying the platelets at a very rapid rate. So needless to say, that was June of 1993. I was diagnosed. September of 93, 3 months later, I had my spleen removed after being on high dose, 100 milligrams a day of steroid, which has its own side effects that caused catastrophic changes to my body over 30 years' time, which we'll talk about. But essentially, I was diagnosed with this condition that's managed with steroids. And if it doesn't respond to the steroids, they would give a platelet transfusion if you're actively bleeding. But I ended up having being on steroids and having various treatments over the next couple of years, IV therapies and all sorts of things to try to stabilize my platelet count, because my body was literally, every time I got a cold or a flu, which is being exposed to people, I actually was in the patient care setting as a nurse, so I'm exposed to sick people all day long working. So what would happen is, about every, the first couple of years were horrible, but then about 2 or 3 times a year after that, during flu season, from November to March, I would get a cold. A viral bronchitis is what it was. A viral bronchitis triggered the condition, and I would take some time off work, go into the emergency room, be near death, platelet transfusions at times. This happened 2 to 3 times a year for the last 29 years. It's actually what caused my medical retirement from healthcare in 2016. So over the years, all the steroids, and 83 near-death experiences. Each wow. Of 83, 60 before 2016, and 23 since 2016. And it was always 82 of them were from viral bronchitis. The 83rd was COVID. COVID was the viral trigger for that one. Each time it's emergency room. If you're actively bleeding, it's a platelet transfusion. If I wasn't actively bleeding, it was IV solumedrol steroids, followed by 6 days after I was discharged home, 6 days of oral high steroids, corticosteroids. Those steroids calm the condition down. And I basically had to be on steroids on a routine basis to keep my platelet count at a livable level. All the while, through, from 1993 to 2016, I'm working as a nurse and a doc and a nurse. inpatient care setting. I eventually tried to move to the management setting, which we'll talk about. But essentially, the steroids caused the body to break down. So there are fractures and disc injury, disc herniations, and meniscus tears in my knee. 7 months ago, I had a knee replacement because of the arthritis from all the steroids. So I'm a walking miracle, but every time in the emergency room, I asked God to just let me help some more of your children and give me a chance. I will help your children if you help me. And he did. And God's been faithful ever since. And I have been literally, I shouldn't even be here. I mean, 83 times in the emergency room, rescue ambulance, near death. Could have taken my life any one of those 83 times. But because I think God recognized that I was serving his children and, selfless and caring more about others than myself, he's given me a chance. And so I'm here today because God said, keep helping my children and I'll help you.
That is so beautiful. That is so incredibly beautiful. And I would like to add something here.
You can see how emotional it gets me.
I would like to add something here
Yeah.
is that you should be here. You deserve to be here.
Absolutely.
I mean, I had a friend of mine told me the exact same thing, that, you really shouldn't be here. And I thought to myself, and I didn't say anything at that particular time. And I've talked to other people since. Yes, I should be here. I demanded that I be here. And I wouldn't take failure, as far as I was concerned, was not in the cards. It was not an option. And so, because of that drive, yes, I should be here. And yes, you should be here as well. And I want to interject at this time. We're going to continue this conversation in part 2. I forgot to mention that at the beginning, which
You did.
Oh, okay. I did.
You did.
So there will be a part 2 with Dr. Gary. So share with us a little bit more about your journey, your personal health journey. And then next time we'll talk about your profession.
So with, the family has been so engaged and supportive, and, I just wanted to see our grandkids. I wanted to build our grandkids' houses, that wasn't like, I want to be here for my grandkids, for our grandkids. I want to be here for the family. I want to be, still the supportive papa to the girls and my wife and the family and the handyman for the family. So I had to stay really healthy. I always practiced what I preached. I learned, I was a professor of nutrition that we'll talk about, and a professor of clinical informatics, the electronic medical record stuff that I learned at Kaiser. But in my communication with patients and families and my own nutrition, I realized that, nutrition could change your life. And the way you treat your gut, your microbiome, and your energy and your immunity and your immune system, and herbal and plant-based nutrition can save lives and can reverse cancer or prevent cancer. So, conventional medicine says you take a pill for an ill, you cut it out if it's there, if it shouldn't be there. Uncontrollable growth of cells like cancer, could just cut it out, give chemotherapy to try to kill it. Problem with chemotherapy is that it kills more of the good cells than the bad cells. And when it kills the good cells, those are your defenses, your white blood cells. So most people pass or succumb to chemotherapy, not from the cancer. And you've seen this in your own life. I've seen it. We've had many family members, as I'm sure everybody hearing this has had, where sometimes they're not given the opportunity. They didn't do They weren't given alternative, health information, but I did a lot of research and homework and found out that nutrition is the key, and lifestyle and behavioral modification and inspirational and wisdom and empowerment and positivity and mindfulness, yoga and exercise, and all of those things have to be in balance if you want to be bolster your system, your immune system, to be defensive against cancer, as well as reverse cancer. Because I've seen it in my own life, and I'm sure many families have, where tumors developed, were shown up on CAT scan or X-ray, and then weeks later, they're gone. And medicine has no explanation for this phenomenon, but God has an explanation for it, and God intervenes, and God can remove, as well as your body can remove cancer with God's grace. And it may be the reason why you're in remission, may be the reason why we're both talking here, but your nutrition. And so I had to bolster my immune system, because my immune system was so suppressed from all the steroids, which, so it's a horrible cycle of the disease reducing your body's ability to fight disease, and then the treatment for your disease or illness reduces your immune system's defensiveness, puts you at risk for getting a virus. So I had to fight this cycle of immune suppression. I did that with nutrition, exercise, and attitude. And I can say today, I feel the best I've ever felt in my life. I have a great regimen routine, like you've shared with me your routine, very similar. Plant-based nutrition, healthy, immune bolstering herbs, antioxidants, everything to keep your body as defensive as possible. So I literally wouldn't be talking to you today. You wouldn't be here with me today if we didn't have that will to live, and that will to know that the power of God's harvest could heal anything, and has.
Absolutely. Absolutely. And what I'd like to point out is, for those that have followed the channel and have watched the videos, what's fascinating to me is this consistent theme of characteristics, similar characteristics with most of the people that I've had the great honor to interview. And the characteristics, so many people have faith and believe in treating the whole body and having a positive attitude and nutrition. And so it's fascinating to see all of these characteristics, but where are the people that have gotten afflictions, cancer, heart disease, whatever it may be, that come out the back end that are really negative and are, have opposite of these characteristics? You really don't see them, or I haven't seen them. And so I believe in my heart that there's something absolutely to do with all of these things. And so what we're going to do right now is we're going to close out this interview. So what I like to do is ask you for your final thought, what you'd like to leave everyone with, and then we're going to resume this conversation again in part 2. So, Dr. Gary, do you have any final thoughts?
Absolutely. I first want to just applaud your altruistic, humanistic, holistic efforts in trying to get this message out to people and families that have either gone through the challenge of cancer or a life-threatening illness, or they've overcome it. And I resonated, we connected immediately when we were sitting down together at the wedding. It's just like soulmates, like we were, like-minded, like goal-oriented, the same passion that you bring to this platform and assembling this incredible brain trust of advisors and health professionals and lay people that have gone through, that have succeeded. They've beat the odds of conventional medicine, either with or without alternative medicine. And I was just such a believer in faith-based recovery and healthy living that starts here. It really starts with you changing the constructs and the paradigms that we've been fed through the media and through social that have been so negative, like disease. Like once you get that diagnosis, then you are doomed. And that is not the case. That should empower people to say, nobody is going to put a limit on my life like my mom did, like we did. Nobody's going to take for granted the power of changing your mind, changing your approach, changing your nutrition, changing your exercise, doing what you can to say, nobody's going to put a limit on my life. I've got a lot of living to do. What is it going to take? What can I do to bolster my body's ability to fight and prevent illness and disease? How can I have a thriving life through effective positivity and empowerment and mindfulness and exercise and lifestyle? And how can I educate people more about this? This is precisely why you set up this platform, which is fantastic. I've watched some of your videos, and it just resonated with the doctors and the people that you've had on here, sharing their journey. And I just believe so strongly in getting the message out. And there's right now, in the era of the internet and social media, we have an incredible opportunity to impact millions of people with videos like this, with information from non-conventional healthcare practitioners and behavioral health professionals and humans, lay people that have gone through the experience and had positive outcomes from not accepting the black and white, not accepting the diagnosis, and not accepting conventional medicine's approach to do it our way or the highway. So I applaud you for this. It's so important. It's incredibly important to educate the people from very early on. I mean, getting to the kids at age 5. I remember taking care of a little 5-year-old, beautiful little daughter of our neighbor who was a doctor, a pediatrician. And she came into my office. They brought her in because she had shoulder pain. Excuse me. She had shoulder pain. And in a 5-year-old to have shoulder pain, and we're trained as primary care physicians. So it's either, it could be as bad as cancer. It could be as easy as a pinched nerve. And so we were trained to know the difference. And when I saw her in our practice and I found out and did a little hunting, it turned out that she just very simply had a pinched nerve in her neck, in the area that supplies the shoulder. And the way we approached it was with a teddy bear on her chest, and her mom and dad were right there. And I just explained to her, in a very lay person's way. Imagine, I took it upon myself to basically educate the 5-year-old. It's the same way I would educate the 85-year-old, with very simple terms, with a teddy bear, showing the teddy bear had a spine. One of those little bones in the spine can move out of place, push on a nerve, cause the pain she's having. And that we, as natural doctors, we can actually take that pressure off and get her tuned up and back to pain-free life. She was all for it. I showed her first how I took care of the teddy bear on her chest, how I would diagnose and find the area, and then I would show her. And basically, it was natural remedy to a problem that, her parents could have taken her to orthopedic surgeons and neurologists, and, where's the shoulder pain coming from? So the bottom line is that, we just want to empower and educate the young and the old to there's more to life than a diagnosis, and you can make a change. You could prevent cancer. If the body has the ability to create it, it has the ability to remove it with the right circumstances. So that's what I told all the patients, and that's what I educate all friends and family. And that's why I believe wholeheartedly that, this platform is going to make a world of difference to the world, because they need to have the information that they don't always get from conventional healthcare.
Thank you so much, Dr. Gary. I mean, that's beautiful. Absolutely beautiful. I really appreciate your time and your presence. I am honored. Thank you so much. And with that, what we'd like to do is wrap it up. And I'd like to thank everyone for joining us here at To Be Your Own Hero, and make the most out of every single day, every single hour, every single minute, every single second, and every single breath. Life is beautiful. Life is meant to be lived. And I would suggest everybody go out and live and help people and be concerned about your fellow man. And that's the way that this world is going to heal, is if we make an effort as human beings to try to make somebody else's life a little bit better. And with that, I'd like to thank everyone. Thank you, Dr. Gary, for your time and sharing openly about your journey. And we'll come back to you in a future interview. And with that, thank you, everyone, for joining us here at To Be Your Own Hero. We'll see you next time. Thank you so much. Be blessed all.
Thank you, Mark.